Okay, our next paper is Dr. Jürgen Rehage. ACTH test sensitivity affects disposition for high body condition in dairy cows during the transition period.
Thank you, Mr. Chairman. I'm going to present a study mainly done by Claudia Raschka, Anja Schacht, Lea Brandt, and Mrs. Ruder. Anja Schacht is giving a presentation later in the day, and the other people were unable to attend this meeting, so I'm giving this presentation on behalf of them. I think I can make that very short because we heard it already. Cows are in negative energy balance, compensate that by mobilization of fat from adipose tissues, and develop frequently in early lactation subclinical ketosis, fatty liver, and all the associated diseases. We also heard that, in particular, overconditioned cows are at risk for excessive lipolysis. Only point I want to like to add is that cows are mobilizing, at least we have indications, in particular fat from the abdominal adipose tissue and compared to the subcutaneous adipose tissue. So they are in a tough metabolic situation in the transition period, but they have to cope with more challenges in their daily life and are permanently exposed to stressors coming from the environment, from herd mates, stockmen, procedures which need to be done, from diseases, and they are reacting on these stressors by release of catecholamines or cortisol, and both stimulate lipolysis, and additionally glucocorticoids modulate a little bit the metabolism and the use of substrates. However, cows are reacting differently on stresses. That depends on the intensity of the stressor, previous experience, and there's also a genetic and epigenetic disposition, how far the HPA axis and the release of cortisol is affected by the stressor. Commonly, we test the individual HPA reactivity or sensitivity by the so-called ACTH test, which means we are injecting ACTH, which will induce a release of cortisol from the adrenal glands, and we can measure this cortisol rise in the bloodstream. And from that concentration curve over time, we can have the baseline cortisol concentration, the peak concentration, the peak net concentration, what means peak minus baseline. We have the area under the curve and the net area under the curve from this test. So our hypothesis was basically that the individual adrenal cortex sensitivity affects energy metabolism in dairy cows during the transition period, and we wanted to compare low and high responder in the ACTH test regarding the production parameters like dry matter intake, milk yield, energy balance, and blood parameters reflecting metabolism and also body condition. So we measured subcutaneous and abdominal fat depots. So we used 22 multiparous lactating clinical healthy cows in a freestall, fed a typical diet during the transition period, and we collected data from day minus 42 related to parturition until day 100, recorded production data, took weekly blood samples for hormone and metabolic parameters, and assessed the subcutaneous abdominal fat depots on day minus 42, day 321, and day 100, and took liver biopsies for assessment of liver triglycerides in the liver tissue. So very briefly, using sonography, you can calculate the weights, or at least estimate the weights of the subcutaneous and abdominal tissues, and you can split that up into the omental, retroperitoneal, and mesenterial tissues. Just by measuring the thickness, for example, here the thickness of the fat layer around the right kidney, and at some other points, a technique which was recently published by Claudia Raschka. How we did the ACTH test, we injected 80 micrograms of ACTH, took blood samples in short-term intervals, and calculated the baseline concentrations, peak, peak net, AUG, and AUG net. And then here you see the response, and there were low responder and high responder, and we split the 22 cows into 2 groups of equal size, the high responder group and the low responder group, and used mixed with ACTH group time and interactions and the individual animal for the statistical analysis. So coming to the results, we saw the typical decrease in dry matter intake around parturition and an increase after parturition. Comparing the low responder and the high responder, there was no significant difference. There was also no significant difference in milk yield between the 2 groups, but there was a significant difference between low responder and high responder regarding the milk fat percentage in early lactation, but basically there was no difference in energy balance comparing low and high responder cows. Looking at plasma NEFA concentrations, there was a significant rise prior to parturition in the low responder, and the high NEFA levels were maintained during the early lactation period in the low responder cows longer compared to the high responder cows, and accordingly there was a significant effect on BHB, so ketone body concentrations in the low responder cows compared to the high responder cows. And what we have also seen is that the rise in liver triglyceride content in the low responder cows was significantly higher than in the high responder group. So coming to the fat depots, what we measured, starting comparing subcutaneous and abdominal fat depots, first thing what we see is that about 2.5 times more fat is stored in the abdominal cavity compared to the subcutaneous adipose tissues. In both depots, we see a rise in the dry period, so they are gaining size in the respective depots, and they are losing fat from these depots, and that was true for the abdominal fat and also for the subcutaneous fat. There was also effect of depot by time, insofar that they are gaining more fat in the abdominal tissues and they are losing more fat from the abdominal adipose tissues compared to the subcutaneous adipose tissues. There was also an effect of the ACTH group on the size of the respective depots, insofar that for the subcutaneous as well as for the abdominal adipose tissues, the low responder cows had always a larger depot size than the high responder cows. That was true for the subcutaneous as well as for the abdominal adipose tissue. So they are simply a little bit more fat. Looking at the dynamics and the mobilization of, and the gain and the mobilization of fat from the different depots, you see that there is a gain in subcutaneous adipose tissue in the low responder, but it's higher compared to the high responder, and they are mobilizing significantly more fat during the early lactation period in the low responder compared to the high responder, and the same was almost true for the low and high responder regarding the abdominal adipose tissue, but the effect was basically not significant. However, when you differentiate between the different depots in the abdominal cavity, so looking at the omental, the retroperitoneal, and the mesenterial adipose tissues, you see that there was no effect of the ACTH group on the omental adipose tissues, but looking separately at the retroperitoneal and the mesenterial adipose tissue, there was also an ACTH by time effect in these different depots. Okay, coming to the end and summarizing what we have seen, the low compared to the high responder cows in the ACTH test revealed higher body condition during the dry during the transition period, mobilized more fat from adipose tissues, in particular from abdominal tissues, had higher milk fat percentages, higher NEFA levels, higher BHB concentrations, and higher triglyceride contents in the liver after parturition, but there were no differences seen in dry matter intake, milk yield, and energy balance. So in our conclusion, it shows that dairy cows with a low compared to a high sensitivity of the HbA axis appear to be disposed for obesity and the fat mobilization syndrome, or in other words, it appears to us that unwillingly, unintentionally selecting cows not only for milk yield but also for being nice is a kind of selection for cows which are nice, but a kind of couch potato as we see that in the metabolic syndrome in humans. Thank you for your attention, and I leave the rest for the discussion.
Okay, we'll open this paper for any questions. I think we'll go to the question at the back first.
Andrew Fisher from University of Melbourne. What is the relationship between the sensitivity to ACTH in cows and their stress responses to a real life situation?
So there's little done in cows. We have done for that reason a study comparing the stress response on a typical stressor like claw trimming in lateral recumbency. And there's a very close correlation between ACTH results and the response, the cortisol response on a typical stressor. Does this answer your question? Yes. Yeah. Okay.
It's really interesting what you're finding. I'm a little curious, your choice of the time when you did the ACTH test. You're thinking it's probably more genetic than it is an adaptation to a physiological factor. In other words, would you have gotten the same response had you checked those cows 2 weeks into lactation or 2 weeks before lactation?
I'm uncertain if we can do the test before lactation because it releases cortisol and maybe it will end pregnancy unintentionally. However, that is a question we ask ourselves as well. The reason that we did it on day 106 was that we took biopsies from different tissues and all the people wanted to do studies on molecular basis, and we didn't want to see the cortisol effect on these results, and that was that we have done the ACTH test in the end. But indeed, we suppose that the main effect is intrinsic, coming from genetics or epigenetics, whatever, and it doesn't matter if you're doing that early lactation, later in lactation, so before they are getting even pregnant, so there should be some consistency. And it's not published, but I know that Rupert Bruckenmeier from Bern did a study doing ACTH tests repeatedly, and the high responder remained high responder, and the low responder remained low responder. It's not published, but I think he's right.
Pedro Melendez from University of Missouri. Regarding statistics, you show some models where you have time effect, group effect, but not interaction. So I'm wondering how you got that. It's difficult to understand.
I'm not sure if I got the question right, because I showed the interactions between
some of models, I don't remember which one, but you demonstrate there is time effect, group effect, highly significant,
yeah, and then there was
but the interaction wasn't significant.
No, for example, for the abdominal depots, there is no group effect and no time by group effect. So the subcutaneous and the total abdominal fat was not significant regarding ACTH test results, time by group effects, and so on and so on. But the different depots within the abdominal cavity, there was a significant time by group interaction.
Okay, yep.
Okay, I'm going to thank the speaker very much, and we'll move on to the next talk. Thank you.